Welcome to Dr. Balaga's podcast for the Curious Doc. Today is June 15, 2026. This video is on a New England Journal of Medicine correspondence published 2 days ago, June 13, 2026, titled Clinical Long Read Genome Sequencing in Rare Disease Diagnostics. Rare genetic diseases often require multiple assays. This NEJM study evaluated clinical long-read genome sequencing as a first-tier diagnostic test. 1,000 samples were utilized, 832 index patients plus 168 parents, 748 singleton tests, 84 patient-parent trios. It's conducted in the Netherlands, representative of our 2022 diagnostic workflow. About 30x genome coverage compared with long-range genome sequencing with standard of care testing using identical variant interpretation strategies. No follow-up duration reported. This is a cross-sectional diagnostic performance study. Conclusive diagnosis with long-range genome sequencing 160 out of 832, 19.2% versus standard of care 137 out of 832, so it's about 16.5%. Possible diagnosis, long-range genome sequencing 8.9% versus standard of care 11.9%. Overall concordance 96.4%. Diagnostic outcome improved by refined in 28 patients, that's 3.4%. Standard of care superior in 2 patients, 0.2% due to mosaicism and low coverage. DNA methylation profiling identified clinically relevant findings in 6 patients. The 20x coverage predicted false negative rate of 1.1%. Modeling 15,150 referrals. The diagnostic yield was 18.9% versus 16.4% for standard of care. So a plus of 2.5 percentage points. Limitations: diagnostic letter rather than a full trial. Limited low coverage regions, about 0.5% of the autosomal disease genes. Rare misses from mosaicism and stochastic sampling. Key takeaway: long-range genome sequencing can consolidate multiple genetic assays into one platform, improves diagnostic yield, enables haplotype phasing and methylation analysis, and supports use as a first-tier test. Clinical pearls: long-read genome sequencing achieved a higher conclusive diagnostic yield than standard of care testing, 19.2% versus 16.5%. Diagnostic concordance was very high, 96.4%. Greatest advantages were haplotype phasing, detection of novel variants, structural variation assessment, and methylation profiling. Only 0.2% of the cases were missed by long-range genome sequencing, mainly due to mosaicism and low local coverage. Reducing the coverage from 30x to 20x resulted only a modest predicted false negative rate, 1.1%. Population modeling predicted a 2.5 percentage point increase in diagnostic yield. This study supports transition towards a single comprehensive first-tier genomic assay for rare disease diagnostics. This is an infographic on this publication. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.